Hi everyone, I'll be speaking for a couple of minutes on the dangers of vaping. So why should you care about vaping? Vaping affects your community, particularly local youth. 1 in 6 New York City high schoolers have vaped in the past year. This adds up to 2.1 million US students using e-cigarettes in the past year. Now that we've put the impact of vaping into context, I will briefly outline what I will be going over in this presentation. First, we will talk about what vaping is. Next, we will discuss the harms surrounding some common myths about vaping. And finally, I will share some local and online resources if you or someone close to you is trying to quit vaping. So what actually is an e-cigarette or vape? E-cigarettes and vapes function in very similar ways. The difference is just in appearance, as vapes tend to be a little larger, and often e-cigarettes look like traditional cigarettes. Both are devices that produce an aerosol by heating a liquid that usually contains nicotine, flavoring, and other chemicals. So there are several examples of types of e-cigarettes that you might see. Some e-cigarettes are made to look like regular cigarettes, cigars, or pipes. Some resemble pens, USB sticks, and other everyday items. And there's larger devices such as tank systems or mods that do not resemble other tobacco products. So now that we've gone through an overview of what an e-cigarette is, let's debunk some myths. Some of these you might have heard before if you are familiar with vaping. So safer than cigarettes does not mean safe. This is a map showing the number of lung injury cases as a result of vaping in 2019. The green markers are all of the states that have seen vaping-related deaths. As you can see, the death toll is 68, and there have been 2,807 injuries as of 2020, which means that the death and injury toll has definitely risen by now. One significant factor in cigarettes that impacts their safety is vitamin E acetate. This is an oily additive in vapes with THC. It inflames the lungs and impacts the normal function to expand and contract. Vitamin E acetate is also present in 94% of severe breathing issues associated with vaping. The next point is cigarette addiction is a reality. E-cigarettes have 70% more relapses when quitting than with traditional cigarettes. This is due to the fact that Juul pods have the same nicotine level as 20 cigarettes. So you might be asking yourself, what is nicotine? Nicotine is an extremely harmful substance. It is highly addictive and increases the risk of using other tobacco products. It causes an increase in heart rate, blood pressure, and risk of heart attack and stroke. It increases the risk for future marijuana use, disrupts sleeping patterns, and it can also harm fetuses during a woman's pregnancy. Another point is vape aerosol is not water vapor. So you might be asking yourself, if it's not water vapor, what exactly is going into my body when I vape? So several components of vape are flavorings such as diacetyl. This is linked to popcorn lung, which draws youth in due to the flavoring. There are heavy metals, there are cancer-causing chemicals, there's obviously nicotine, there's volatile organic compounds, and there's also ultrafine particles. Another really strong point about vaping is that we do not know the long-term effects. However, all we do know are the short-term effects. So, vaping-associated pulmonary illness, this includes conditions like pneumonia, lipoid pneumonia, which is basically when the oils of the product are invading the lung tissue, respiratory distress syndrome, and other serious lung injuries. Additionally, malfunctioning vaping devices can also cause external burns. So now that you've heard about all what vaping is, the myths and the harms, you might be thinking, how can I get help near me? So there's several options out there, both virtual and in person. So I'll first go over some of the virtual options. One is the New York State Smokers Quit line. You can call the number 866-697-8487, and this number connects you to a quit coach, and also resources to apply for free nicotine medications. The second option is Truth Initiative. You can text Drop the Vape to 88709. And this is a free texting support program specifically targeting youth from the ages of 13 to 24. There's also a lot of in-person help around the New York City area and around Betances Health Center. One useful resource is the New York City Health and Hospital Guide to Smoking and Vaping Cessation Program, and this separates vaping assistance resources by boroughs. Another resource is the New York City Health Map, and this lets you input your zip code or address, and it shows you the health services near you that offer free smoking help programs. So thank you for listening to my presentation. If you have any questions, please discuss it with your primary care providers at Betances Health Center.